Welcome to Doctor to the Garbage Pail Kids, the single best way to learn medicine after an accredited medical school has turned you down. I'm Matthew Tortora, and I'm a board-certified pathologist in New Jersey. And in this series, I'm going to diagnose the aches, pains, and other ailments of the characters from that all-at-once beloved and reviled iconic 1980s trading card series, the Garbage Pail Kids. But before I begin, a quick disclaimer that the content of my site is for educational purposes only and does not substitute professional medical consultation with your actual doctor. If you'd like some general background on what the Garbage Pail Kids are, please feel free to check out my teaser installment, listed in the link below. Otherwise, sit back and enjoy the course. Today we're going to talk about Drunk Ken. Released in 1985 as card number 9B of the first series, Ken has had way too much to drink. His eyelids are drooping, he's drooling, there's a blob of mustard on his tie, or maybe it's vomit, and there are signs that he's no longer in control of his faculties. The pastel-colored animals flanking him are a form of alcoholic hallucinosis. He's also about to fall into an uncapped manhole. Equally as troubling, the baby bottle in his hands filled with old rot gut, a term for cheap, often dangerously poor quality liquor, signifies that he's not done drinking. There are also signs that this isn't his first introduction to the bottle. He's unkempt, unshaven, and his nose is bright red, the so-called gin blossom. All signs of chronic alcohol overuse. Alcoholism. It affects almost 30 million Americans over the age of 12. According to the American Cancer Institute, alcoholism is a chronic disease in which a person craves drinks that contain alcohol and is unable to control their drinking. A person with this disease also needs to drink greater amounts to get the same effect and has withdrawal symptoms after stopping alcohol use. Alcoholism affects physical and mental health and can cause problems with family, friends, and work. In other words, an alcoholic is someone whose drinking causes physical, psychological, or social problems for themselves or others. If Ken were to see a doctor, he might start with a set of 4 questions known by the acronym C.A.G.E. Clinicians use these questions to assess whether a patient is overusing alcohol. Have you ever felt that you needed to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? Have you ever felt that you needed a drink first thing in the morning, the so-called eye-opener, to steady your nerves or get rid of a hangover? Chances are Ken would answer yes to all of these questions, and a presumptive diagnosis of alcoholism could be made. But there were probably signs of a problem for a long time. It's no secret that alcohol abuse takes its toll on the body. It's hard to believe, but this is what Ken looked like before he ever started drinking. Alcoholism comes with a panoply of potential health disorders, affecting almost every organ in the body. The organ that most comes to mind when you hear alcoholism is the liver, a red-brown football-sized organ tucked under the right diaphragm. Its functions are so innumerable that we can't live without it. They include the production of bile, cholesterol, albumin, hormones and clotting factors, fat and protein metabolism, vitamin storage, and blood detoxification. It's this last function that makes it especially susceptible to alcohol abuse. Alcohol is made of ethanol, and ethanol is a poison, and it's up to the liver to detoxify it before it kills us. But the irony is that the liver can't actually protect itself from the very poison it's trying to break down. Not only does ethanol directly damage the liver cells, but the substance that the liver breaks it down to, called acetaldehyde, can actually modify the genetic material in the liver cells in a way that makes them induce their own death, cell suicide. Then, to add insult to the injury, the specialized cells that surround the liver cells start releasing chemicals that attract inflammation, which further damages the liver cells. And that's just after one drink. It gets even stranger with chronic alcohol use. After repeated exposure to alcohol breakdown byproducts, the liver cells may begin to change themselves into a totally different type of cell, the fat cell, which appear as white circles in this microscopic image of the liver. These fat cells are useless in performing the normal tasks of the liver, and the condition is known as fatty liver disease. In other instances, the repeated damage leads to scarring, wherein the liver begins to be crisscrossed by bands of fibrous tissue like a spider web, trapping islands of liver cells in between. One such band can be seen as a thick, curved pink line in this microscopic image of the liver from an alcoholic patient. When the scarring gets severe enough, it's called cirrhosis, which causes liver failure. And when that happens, a series of unfortunate signs and symptoms may develop. Yellowing of the skin and eyes, known as jaundice, from the backup of bile products. Congestion of the veins of nearby organs, like the esophagus, known as varices, which can tear open, leading to bloody vomit. And filling of the belly with fluid leaking from the circulatory system, called ascites. Drinking can increase blood pressure and risk of stroke and diabetes. Drinking is also bad for the heart. In some people, it leads to a heart condition called dilated cardiomyopathy, in which the chambers of the heart become enlarged. When that happens, the muscles of the heart lose their ability to pump blood effectively. It occurs in up to 2% of heavy drinkers, which means 600,000 people in the US alone. Drinking can also injure the pancreas, a tan organ shaped like Long Island, tucked around the start of the small bowel. The pancreas has many functions, one of which is to release chemicals into the gut to help digest food. One of them is called trypsin. In some drinkers, the condition it causes is called acute pancreatitis. In fact, up to 25% of acute pancreatitis cases worldwide are caused by alcohol consumption. In this condition, the alcohol injures the pancreas cells that make the trypsin, causing it to spill into the substance of the pancreas, where it begins to digest itself. When this happens, death is the expected outcome in almost 10% of cases. Chronic alcohol use can also cause cancer in the liver, the breast, the large bowel, the esophagus, and the head and neck. Of cancers of the head and neck, including the lips, mouth, voice box, and throat, 75% are caused by alcohol and/or tobacco use. For those who like to drink and smoke together, as so many do, the risk of cancer is even higher than what we would expect from simply adding the individual risks together, because the alcohol acts as a solvent for the tobacco. Alcohol use can weaken the immune system, reducing our ability to fight off infections. The lungs are particularly hard hit, with increased risk of bacterial pneumonia and viral respiratory infections, and it can also worsen asthma. Alcohol can also injure the lining cells of the gut and kill off the good bacteria that normally reside in our guts, making it harder to absorb certain nutrients. The impact on the immune system begins after only one night of drinking. It's also important to keep in mind that although alcoholism is itself a mental health disorder, about 1/3 of alcoholics also suffer from another mental health disorder, including depression, obsessive-compulsive disorder, schizophrenia, and bipolar disorder. In the case of depression, it's a bit of a chicken and an egg situation. It's not uncommon for those suffering from depression to so-called self-medicate with alcohol. But alcohol itself is a depressant, thus increasing the risk of suicide. Alcohol acts on your brain to decrease your inhibition. It's what makes it a good social lubricant. But it can also increase the risk of violent or aggressive behavior, risky sexual behavior, and actions made out of poor judgment. One very risky behavior is drunk driving. In 2022, almost 1/3 of the 42,000 traffic crash deaths involved drunk drivers. For drivers in the US, the legal limit for blood alcohol level is 0.08%, which translates into 0.08 grams of alcohol per 100 milliliters of blood. For someone my weight, if I drink 4 beers, I'll be above the legal blood alcohol level for about 2 hours. Now let's see how Ken stacks up. As I've already mentioned, his baby bottle is filled with something called Old Rot Gut, which is cheaply made hard liquor, probably whiskey. A regular baby bottle holds 9 ounces, and by the looks of Ken, he probably drank the entire bottle. If we plug in my weight for Ken for the sake of argument, and 9 ounces worth of liquor, we see that Ken will be at twice the legal blood alcohol level at 2 hours, and won't drop below the legal limit for at least 7 hours. If he gets in the car and turns the key, not only is he breaking the law by driving impaired, but he's probably going to crash. Alcohol also acts on the lower part of the brain called the cerebellum to slow your coordination and motor skills. It can blur your vision and decrease depth perception. It slows your reaction time. It blunts your alertness. It impairs your judgment. And some of this starts to happen well below a blood alcohol level of 0.08. Inability to perform complex tasks, for example, begins at a blood alcohol level of just 0.01. So with all that in mind, let's come up with a plan to keep drunk Ken sober. The first challenge we'll encounter is alcohol withdrawal syndrome. Milder forms of withdrawal include anxiety, insomnia, headache, and gut pains. The severest form of withdrawal is known as withdrawal delirium, or delirium tremens, or DTs for short, symptoms of which include hallucinations, fever, high blood pressure, and seizures. Although only a small percentage of patients with alcohol withdrawal syndrome will develop DTs, those that do can die from it. What causes these symptoms? Alcohol is a central nervous system depressant by acting to stimulate production of a neurotransmitter called GABA, which has a calming effect. With prolonged alcohol use, the body overproduces another chemical called glutamate, which has excitational properties to balance the excess GABA. When the alcohol intake suddenly stops, it leaves an imbalance of too little GABA and too much glutamate, which leads to the withdrawal symptoms. The treatment for alcohol withdrawal is benzodiazepines, which are a class of anti-anxiety drug. Gabapentin, known by its brand name Neurontin, which is an anti-seizure medicine, and phenobarbital, a type of barbiturate. Since alcoholics are often nutritionally deficient, it will be necessary to give them vitamin supplementation, in particular vitamins B1, also known as thiamine, and folate, deficiencies of which can lead to severe and life-threatening neuropsychiatric symptoms. Once the withdrawal subsides, attention should be turned to address the underlying state of alcohol abuse. Currently, there are several medications approved to do this. 2 of them are Naltrexone and disulfiram, and their mechanism of action is very interesting. Naltrexone works by blocking opioid receptors in the brain. By doing so, they block the euphoric or pleasure effects of alcohol. In other words, they make drinking less fun. In the case of disulfiram, branded as Antabuse, it goes one step further. It works by increasing the amount of that toxic alcohol breakdown product, acetaldehyde, mentioned earlier. Doing so causes a host of unpleasant symptoms, including sweating, nausea, and increased pulse rate. It literally makes it painful to drink. Last but not least, the recovering alcoholic will need a support network, the most famous of which is a fellowship called Alcoholics Anonymous, or AA. It was started in 1935 by 2 men from Akron, Ohio, who themselves were looking for a way to stay sober. Out of this grew the 12-step program to recovery, and since that time, it has expanded to 2 million members in 180 countries. But just how effective is it? Recent meta-analysis of studies on the effectiveness of AA versus more sophisticated psychotherapy and/or counseling found that it is at least as good and in some ways better than these modalities, all while saving the individual thousands of dollars a year on healthcare costs. As we conclude this session and wish Ken well on his journey to sobriety, let's summarize the big points from our session. An alcoholic is somebody whose drinking causes physical, psychological, or social problems. It's associated with innumerable health risks, including liver disease, heart disease, depression, and cancer. If your blood alcohol content is higher than 0.08 and you're driving, you are breaking the law. Lastly, after cessation, treatment for the symptoms of withdrawal, vitamin deficiency, prolonged addiction, along with a social support network, is necessary and sometimes life-saving. Here's hoping that drunk Ken gets the treatment he needs, and once he does, with any luck, he'll be back to his old self in no time at all. Thank you for joining me for this episode of Doctor to the Garbage Pail Kids. I hope that I've managed to teach you a little something about medicine while rekindling your nostalgia for the 1980s. If you enjoyed what you saw, feel free to like, comment, share, and subscribe to my YouTube channel.